Tēnā koutou katoa, nā tātaka e ho mai nei, e mihi nui tā koutou nā whanau, tangata e mihi nui tā koe mō tō te whakatau i amatu i te rewa, tangata rōna mai i te mera, e mihi nui tā koe, te whaia he karanga manu ki oruri, tēnā koe. Okay, everyone, my name is Manaia King, and many of you may, well, a lot of you may not know who I am because I stand behind the very talented Maori Sandel, who many of you do know, who's in my team. So for those who don't know who I am, I'm Manaia King. I'm the manager of the Ministry of Health. I'm responsible for the chronic diseases group. My team is responsible for sexual reproductive health, tobacco, alcohol, drugs, and nutrition and physical activity. So we've got quite a number of key issues that we deal with on a daily basis, and certainly things that many of you in this room are very interested in. I first want to acknowledge what Whiturangi had mentioned earlier in regards to kind of order, and certainly we absolutely support the ideal that organisations such as ourselves, as well as organisations such as yourselves, should be more integrated in terms of the services that you deliver to whānau. Because at the end of the day, we are here all to serve our communities, the people who access our services. So I was very inspired by what you had to say, Whiturangi, and wish you well in terms of the leadership group that you're on. So I'm here today to give you all an update on what we have been doing in the Ministry of Health, but I think based on the conversations that I've had with Grant and Nari today, there's been quite a good amount of conversation in terms of what it is that we are doing. And I'm glad to hear that there have been challenges, because that certainly keeps us on our toes in terms of the job that we are responsible for. So I'm also happy to be challenged in terms of some of the things that I'm about to update on, in terms of some of the achievements and some of the activities that we still have to do in the coming future. So this isn't new to you. Those who were present at last year's conference in Takapuna, I mentioned to you some of the key priority areas that the Ministry has made in regards to sexual and reproductive health, and these still remain the same. So these were taken from our last year's statement of intent, but we still certainly keep these as our priority areas. So they are the enhanced management of sexual and reproductive health to improve outcomes in this area. To support providers to deliver on those improvements. Good sexual health for all New Zealanders, that's an obvious one. And people have confidence in the systems and services. So these are the platform by which we deliver the services that we fund, and they will continue to be the platform by which we fund into the future. The challenges that we are faced in regards to what we fund are known to you all, in regards to the high STI rates in this country, the issues around research and surveillance. These are things that we have prioritised in terms of addressing, and I certainly think that my colleagues and I have certainly made some pathway into addressing these issues, but that recognition must go to the sector in terms of the leadership that you've all provided and support that you've provided to the Ministry in meeting these challenges, because these are certainly not new challenges, but they're also certainly not easy challenges to overcome as well. So what have we been doing? Well, I thought the easiest way to represent what we have been doing was to put in a table form, and these activities that the Ministry had actually identified in its sexual and reproductive work plan that was drafted in 2010 and 11. And the Ministry has made quite a number of strides in regards to achieving what it said that it would do. But in saying that, there have been difficulties in doing some of these activities, but because our work plan is a living document, some of these activities which we wanted to do in 10, 11, and 11 and 12 have been shifted out to later years. But this is purely down to capacity. We're talking about 3 people in the entire Ministry responsible for this area. So that's myself, Grant, and Nari. So the 3 people in these room who a lot of the work sits on in regards to getting it done. So I think based on that capacity, I think we've done pretty well. So in 10 and 11, as I mentioned, the work plan was drafted, and was signed off by our executive team and has also been approved by our ministers. We undertook the HIV services review, which many of you may be aware of, the Miller Review, which led to some fairly significant shifts in the way in which we fund positive organisations, and I'm glad to see that we have all of you here, and it's fantastic to have you here today. The ministry also developed a logic model in regards to our services. Prior to having a logic model, a lot of the services that we funded were ad hoc and piecemeal, so we're trying to get some consistency, some evidence, and some high-level strategy around what it is that we purchase. We also commissioned a significant piece of research that's jointly being undertaken with HRC around African communities and HIV. So these are, in 2010, this is when we just launched the work plan. So we were very ambitious and had a lot of aspirations in terms of what we wanted to do. But obviously we were only able to get a few things off the ground. But I do think that these projects in themselves were fairly significant. We turned to 2011-12, we had quite a number of projects and initiatives that we were able to get off the ground. I would coin that year as one of development and one of evidence searching. So we evaluated the theatre program, which is a school-based theatre program that's run across the country in regards to sexuality in schools, and that evaluated really well. We also evaluated the peer sexuality education program that's delivered through by NZSHS. And we also we're very pleased with that evaluation as well, and it's glad to see that Nick's here, who was once the team member of that group, but now is with the AIDS Foundation. We undertook what we called a national conversation around HIV testing and counselling. Now, for many, I believe many of you in the room were part of those discussions, and I'm happy to report that the ministry has received the report, and we're in the final stages of feeding back to Rachel Lemessier, who is the author of that report, and more work is yet to come, and but we're expecting some fairly significant shifts in the way in which we provide leadership around what the sector can expect from what public can expect from organisations. We commissioned the development of a Pacific Sexual Health Framework. Once again, the services that we fund in this space are, we believe we can provide more leadership in regards to what it is that they could be doing. For too long, our Pacific providers have been providing us with that leadership in terms of this is what we've done in the past. If you're not going to give us anything else in the way of what we should be doing, we'll just continue to do this. So we were lucky enough to be able to commission this piece of work and work with a number of Pacific communities to develop a framework so that we can better purchase services for Pacific. We've also, as many of you know, our Manaia Pacific providers are always under enormous pressure in regards to the significant needs that they address. And for our Manaia Pacific providers in this space, we found that many of them were unviable and unsustainable. So we were able to provide them with some funding to be able to support them in order to deliver their services. Now, throwing money at providers isn't the answer, but for these providers, it certainly helped them to secure themselves and so that they're able to continue to deliver their services. We initiated a number of voluntary workshops, so this was mostly focused on at-risk youth in institutions or in environments and settings where mainstream services may not necessarily have access to them. So we were able to do a couple of workshops with Breakthrough Education to help focus in these areas. We did some work with Female Genital Mutilation Organisation International in terms of expanding that. Well, it was a small viability and sustainability fund to help them with addressing this particular issue. We also evaluated the Get Along program. Many of you may be aware of Get Along being the flagship social marketing campaign that's run through the New Zealand AIDS Foundation. And we just recently received a report that all indications showed that as an approach has been extremely successful. And but prior to evaluating it, we did expand the program as well. And we've also commissioned research into around cultural threats in specific communities. This is done through our Pacific branch within the ministry. So those are things that we have ticked off in terms of the activities that we said that we would do. A lot of these will require more follow-up and more work in regards to embedding the evidence bases that these projects created for us throughout our communities, but there's certainly a lot of optimism within the ministry in regards to our contribution to addressing sexual and reproductive health issues. 2012 and 13, which is where we are now, we've embarked on quite an ambitious project, which many of you may know of, and it's a value for money review of all sexual health services. Now, this has been done by KPMG, and I've only recently just been commissioned to undertake this review. Now, the purpose of this review is to inform the ministry how they're purchasing services. It's to inform the ministry what we're actually getting from our services, because at the moment we only know 50% of the picture. And 50% of that picture is the services that are funded through the public health appropriation, which is what I'm responsible for, but we don't quite know what it is that the DHBs fund. And we know that DHBs fund an enormous amount of services and achieve extraordinary outcomes, but it's difficult for the ministry to be able to say, well, this is what we are getting for from the DHBs. So the value for money review will help us understand what it is that we are purchasing for the whole entire fund. Many of you would be aware of the chlamydia pilots that we ran several years back. Unfortunately, the report has been sitting in the ministry waiting for someone to take the information and use it. So between Grant and I, we will be commissioning somebody to actually implement what the pilot recommendations came up with. As a result of the HIV national conversation around testing and counselling, we are looking at updating or creating a ministry policy in regards to this, because we definitely believe that there is a gap in regards to New Zealand, a New Zealand specific policy, even though we know our Australian counterparts have one in place. And we certainly are really keen to look at what linkages we can make with that document. We're embarking on developing some competency frameworks for our Māori providers. They're very much in the same boat as our Pacific providers in that there doesn't appear to be a centralised evidence base in terms of what it is that they should be delivering. So and even when there is evidence, there's still no performance measures in terms of how to measure what it is that they're doing. So we've undertaken a task to develop a framework for them so that they are able to deliver services confidently. And we also need to develop some performance indicators for our logic model, so we're also embarking on that as well. The HIV services review indicated that the ministry needed to review the HIV action plan, and it also indicated that we need to do some work around addressing stigma in terms of those people who have HIV/AIDS. And these are certainly things that are on our agenda. It will take, we have planned to do these in the 12-13 financial year, and I'm certainly looking forward to getting these off the ground. And the work that Grant has done with the Sexual Health Society around developing a best practice care guidelines for the management of STIs. We're now into phase 2 of that, so we're about to embark onto phase 2, and that's been a very exciting piece of work in collaboration with the Society, and I'm looking forward to seeing the implementation of those guidelines. And we're doing some mapping around STI surveillance. One of the issues that we have, which you're all aware of, is that our surveillance is very weak, and it's very difficult to understand exactly where there are spikes of particular STIs. So we are looking at how to improve our SCADA systems, both internally in the ministry, but also through our relationships that we have with ESR, for example. So these are essentially all the things that we have been up to over the last 3 years. It's certainly kind of the big ticket things that we have been doing, but it's not the only things that we have been doing. The work that Nari, who is the sexual health issue lead in my team, has been doing in regards to supporting providers who hold sexual health contracts has been extremely exciting, and also fulfilling in regards to them being able to deliver on their contracts. We are also looking at how we can better integrate our providers with the other organisations in the area. My team alone have integrated 10 of our providers in regards to services, and we're still looking at other opportunities, and especially with providers who want to integrate, because I think there's many of our private providers have questions in terms of how you do it, and our default position is we'll support you in doing that, and that's also in regards to our sexual health providers as well. So that's really all I have to update you on. I could have, I was going to do a spiel on what the government's priorities are, but I think for this audience, I thought I would specify exactly what it is that we are doing in sexual reproductive health. But my manager, who's now recently left the Ministry of Health, he left saying three things: that if we can collaborate and align services and integrate, then we're heading in the right direction. So one message that I would say to you all is if you can do those three things, so collaborate, integrate and align, no matter what that means for you guys, then you're heading in the right direction. So no reira whanau, he mihi rui kia koutou, nā mihi nā whanau, kia ora tātou. Kia ora.
Tēnā koutou te haukainga. Tēnā koe Manaia, koutou ko Grant, ko Nairi. Thank you, Manaia, for updating us on the work that you've done, and it's hard to believe that 3 people have been able to cover such a lot of ground. So thank you for that. Just 2 areas that are not covered in the work that's been done and the work that's ahead. And just wondered if you could give us a bit of an idea about perhaps where they fit into the coming years. The first is reproduction. There's a strong emphasis in your work plan around sexual health, and a little less around reproduction. The other area is sexuality education in schools, and it's been a bit tricky for those of us working in the sector, collaborating and collaborating with schools and not quite knowing what's ahead in terms of the strategic sort of direction for schools and the responsibility for sexuality education. So if you can just give us a bit of a heads up on those 2 areas.
Absolutely, Alison.
Thank you.
It's great that you've raised these 2 issues. Minister Goodhue, who is responsible for sexual and reproductive health, now it was Minister Tuia, but that delegation shifted to Minister Goodhue this year. She's also the Minister of Women's Affairs, and so both of these issues are close to her. She's made it very clear to both the Ministry of Health and to Women's Affairs that we need to prioritise reproductive health. And but lucky for us, we have New Zealand Family Planning, who actually have all of the expertise and the knowledge base in regards to what we can be doing better in this space. So we've been working with family planning to try and figure out what it is that we should be doing. And I've had, I am meeting with Women's Affairs next week, in fact, to progress the plan that they have in regards to increasing focus around reproductive health, especially around sexual and education, sex and education. Given that the ministries had a tripartite agreement 3 years ago to improve sexuality education in schools, and that kind of fell to the side. So these are both important issues, and they're issues that don't rest solely with the Ministry of Health, which is why we're talking with Women's Affairs. But the capabilities of the ministry currently is not there in us providing the expertise around reproductive health, and certainly the responsibility of sexuality education also rests outside of the Ministry of Health as well. But we certainly have a vested interest, which is why we're working with that other ministry to try and get some runs on the board.
Thank you.